ransomware attacks in 2020 were more than all the ransomware attacks in previous years combined.
Yeah. I just saw that and I'm like, that's math. I can't even.
Yeah.
I don't want to do that because it's terrifying.
I had to pull out the brown paper bag and start breathing in it.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
This is Amy Moykich from Atlanta Gynecology and Obstetrics in Lilburn, Georgia, and you are listening to the Help Me with HIPAA podcast.
Welcome to the Help Me with HIPAA podcast, episode 299. This will be the last time I say 200 anything. My name is David Sims of HIPAA for MSPs and Security First IT, and joining me is Donna Grindle of Carden. Good morning.
Good morning, my friend David.
How are you?
Well, trying to cruise into the weekend, just hoping nothing lands on me again. Lots of weirdness this week, but that means it's normal.
Yeah. So are you dealing with a lot of pollen in your area?
Oh, dude, it's awful. But, it's pollen season.
I know, but I went to bed 2 nights ago and there was a little bit of pollen on the ground. I get up the next day, my whole entire driveway, the porch, everything is yellow. I'm talking about a solid sheet. Mm-hmm. It is terrible. And, on top of that, 2 days ago, it's 80 degrees. I have my air conditioner on. Last night, it gets down to 30. Oh my gosh. The weather's crazy. And I looked at the weather this morning, and it's supposed to be back in the 80s again in the next couple of days or so.
This is the cold snap. We usually have one. My birthday's coming up. The rule is don't plant anything until after my birthday because these cold snaps will happen.
Mm-hmm. Yeah, crazy weather. And as they say down here in the South, if you don't like the weather, just hang around for about 10 or 15 minutes. Because it definitely changes all the time.
Yes.
All right. Anything else you got going on?
Yes, but we don't want to go down those rabbit holes, and we both know that.
That's true.
It's not for today. It's not for today.
All right. Well, we still have a lot to cover. Last week, we talked about the HIPAA Summit 2021 news, and we did part 1. Today, we're going to do part 2, and hopefully we get through all that. Otherwise, it'll be part 3 because there was a lot of stuff. So we wanted to go ahead and get to that as soon as possible. But we do want to remind you about the HIPAA Boot Camp Virtual Edition coming up August 17, 18, 19, 2021. We do have people already signing up, so get in and get them going.
Get it going.
Yep.
Get her done.
Get in there early. Lots of good stuff. It's amazing how much people learn because I've got people calling me now. They're asking questions about things that before they never would have questioned because they didn't know to question it.
Mm-hmm. Yeah, it's amazing what happens where about halfway through day 1, all of a sudden they understand why they're there, and it's a whole different ball game. So
yeah. It's always fun to see their look on their face like, oh, we're not doing that. Oh, I didn't know we had to do that. I thought we had this together.
Or my favorite was, we won't name names, but an individual who, long story short, had been in healthcare dealing with this stuff forever. And right in the middle of something we were teaching, pen gets slammed down. Well, I've done that wrong my entire career.
I remember that. I'm about to spit my water out everywhere.
Yeah. So, it is interesting to see we're not covering weird things. It's just clearing up, misconceptions.
Mm-hmm.
Or bad training.
Yeah.
Anyway.
Lots of misconceptions. I love seeing it, though, when they start questioning things. You and I are dealing with one of my clients right now that's having a weird situation with bringing in a different entity and all this kind of stuff. And it's, I talked to her the other day, and she's like, this stuff blows my mind. Like, I can't keep it all in my head what's going on here. I said, but the thing is, you realize there's an issue.
Yeah.
Okay. You wouldn't have realized there was an issue before the boot camp. She's like, oh no, not at all. But, as a matter of fact, all this planning started before the boot camp and nobody ever brought any of this up. And I said, yeah, I know.
Yeah.
Now that you've been through the boot camp, you're like, oh my gosh, the blinders are off. Maybe day one of the boot camp, we should say red pill, blue pill. Mm-hmm. Which one do you want?
It is. There is. We're dealing with somebody that we did an assessment on, and they're like, we have meetings about compliance every month. It can't be that this isn't there. And then we're like, sure, okay, send us the. There's tons of compliance that's being talked about, just not this compliance.
Yeah. That's
you just don't realize it because you're not thinking about it. You think about the other things.
Yeah. Well, it's very similar conversation I had with the gentleman recently, and I asked him about his compliance program. Well, specifically, I said your HIPAA compliance program. He goes, "Oh yeah, we got a compliance program," and I was like, "Okay." And then he went on to say, we comply with this and this and this, and I'm like, "Well, what about your HIPAA compliance? What do you have there?" And he said, "Well, what exactly are you asking?" And my response was, if you're asking me that question, you don't have a HIPAA compliance program because you would know it.
Yeah, you'd be aware.
Yeah, you would know you went through that pain. But yeah, so the more I talked to him, the more I found out he didn't have anything. But, oh well. So we do have a lot to cover today, and pretty much the entire episode is HIPAA Say What. So we're just going to dive right into picking up where we left off last time. So you ready to roll?
I'm just waiting on HIPAA Say What.
Oh, cue it up, DJ man.
I know, right?
I know. I got to find it.
So the boot camp, sign up at the HIPAAbootcamp.com.
Yep.
And it's August. I always forget.
17, 18, and 19.
There we go. So you can spend quality time with us via Zoom. But it is not like any other Zoom meeting you've ever dealt with. I promise.
This is true. 'Tis true.
All right, let's rock it.
All right, HIPAA.
Say what?
Oh, yeah. I'm just excited it works because I unplugged everything yesterday.
I don't know why you did that yesterday. Okay, so I don't remember exactly where we left off. And you may be surprised to know, listeners, that we rarely go back and listen unless there's something specific we're listening for.
We've already heard ourselves once. We don't know.
Although I do love it that at one point David was re-listening to some driving the car. He had his headphones on and he started answering me. And his wife's like, "Who are you talking to?"
I know, I'm driving down the road and all of a sudden, I'm listening to it in my earphones and Donna goes, "What do you think about that, David?" And I'm so immersed in it, I start talking. Then I realize, wait a minute.
That's not it.
Yeah, it was a moment. I have those frequently.
So what I wanted to go with, we're going to start with a panel discussion with CISOs who were sharing lessons learned during the, pandemic shutdown. And there were so many really good and interesting points that I made tons of notes and then tried to pluck out, exactly some ones that were really, really good notes, statements. So one that is across the board, what we've all been saying, but this was put in a very unique way. The edge as we know it is gone.
Mm-hmm.
Yeah. There's a REM song. The new edge is the home and the home router, which is already terrifying. Just that. Let's go with that. And where the traffic flows through the home router, right? And now your biggest concerns at the endpoint becomes an Amazon Echo, a game console, and what was the phrase? 12-year-old wannabe hacker potentially getting at the endpoint. So I thought that was just a great way to put it, that we're having to rethink everything where everybody's like, well, we work from home now. Well, it's changed everything, and a lot of people don't really understand that.
Mm-hmm.
And so here were some stats that I was like, wow, when you think about this. When one of the groups, Sutter Health in California, pointed out that prior to the shutdown, they had a couple hundred people working from home.
Mm-hmm.
And in no time, they went to 15,000.
Oh, gosh.
Like,
I mean,
within a few days.
Think about if this was a planned project, how long that would have taken.
Yeah. It still wouldn't be implemented a year later. Right. And so, and the other point was, and you know, I haven't even looked at statistics on this, but I'm sure there's going to be some coming out. They went from 400 to 500 telemed visits a day to 200,000 a day.
Wow.
You know, so we're talking about a complete revamp of traffic just in that one health system.
Yeah. I mean, it's funny because I think about this and I'm thinking, if I were to come in and say, you've got 2 weeks to completely change your business model, you're going to go from seeing patients in person to seeing them over telemed. You got 2 weeks to implement this. Everybody would say, you're absolutely nuts, crazy, can't happen, won't work.
Yeah.
But that's what happened.
Yeah, you can't say that anymore. You can do amazing things when you are committed to doing it.
I know.
Another point that, and I heard they are all talking about numbers, that one of them said the number of cyber attacks instantly tripled.
Mm-hmm.
And here was a scary one. And people again say, oh, this is that doesn't happen. And so they did not have any layoffs, or they were able to keep everybody connected and up and running. But the affiliate sites, so meaning the clinics and outpatients and all of that feed into the health system, they furloughed people. Turns out, now, granted, they're lucky that people have integrity because they came to them and they were approached and offered $20,000 for their credentials to log into the health system and their multi-factor authentication.
Wow.
I mean, they're lucky. They're just lucky that people had integrity. And you don't know who may have, you know. But this is why you really want people, you need to understand those people were furloughed and they were targets because of that. So keep that in mind, that is not out of the question that could be happening.
Yeah. And people always talk about, you know, I don't have anything anybody wants. My data is not important, whatever. You know, if I go out there and I'm looking for somebody like this target, I'm going to find their Facebook profile, for example. I'm going to try to find somebody who's obviously having some financial issues, or, you know, maybe they've got somebody who's sick in the hospital. Financial issues are going to arise. There's going to be somebody that's going to take that $20,000 because it's super important for them.
Yeah, and people just, they do not understand it.
Well, I know it's not part of this summit that you went to, but recently there was another study that came out that said ransomware attacks in 2020 were more than all the ransomware attacks in previous years combined.
Yeah, I just saw that and I'm like, that's math I can't even.
Yeah,
I don't want to do that because it's terrifying.
I had to pull out the brown paper bag and start breathing in it.
But they did make a point that one of the reasons they felt like they were able to keep up in managing everything was because their entities knew that IT and cybersecurity was a patient safety issue. Not, you know, they're starting to really tie it together, unlike years past. And, you know, we're still talking about that. It's a big thing within 405D is making people understand that, because that does change your viewpoint.
Mm-hmm.
And one of the things that they were so busy dealing with, and when you have these huge institutions and you've got thousands upon thousands of roles and users connected to them, well, now suddenly, you had, we would see that they turned the gift shop into put beds in it in some of the hospitals and just crazy stuff going on. So everybody was changing jobs to help.
Mm-hmm.
They had people that were normally in billing that were now trying to register patients because they needed help. And that meant everybody's roles changed on the systems.
Mm-hmm.
So you had to give them access to what they never needed access to before, but not too much access, and then make sure that when the surge was over or whatever that temporary thing was, you took the access back.
It's like Goldilocks access.
I know, right?
Not too much, not too little.
Just right. Yeah. So that just to be able to keep all of that in line and make those changes as quickly as they were having to make them. Because those things were not happening, over 3, 4, 5 week period before a decision is made. It was 3 hours. We got to do this. Patients are coming in. How are we going to handle this? So it was pretty intense, I'm sure, for all of those folks. And I thought it was also interesting. CHIME is a organization for health information management executives. CHIME, I can't remember the C, but they were getting information from the CISOs in Italy. We're telling them this is what's happening. This is what we're having to do, and it's coming at you next. And when they were getting that information, so they started ramping up, but they had it wasn't a week between it. It was days from when they learned about it. But at least they weren't completely blindsided like their counterparts in Italy. So they were very, thankful that they had that. And especially when they said, we're having to set up alternate sites. So you remember all those tents and all that other stuff with the beds and their tree? There was technology in them.
Mm-hmm. Yeah.
So there was Wi-Fi, there was, 4G, 5G, there were all kinds of things. They were having to set those up too, on top of making sure that they handled these, cyber attacks, and they handled the people moving, and they're setting up these temporary sites and trying to secure them. So they did a remarkable job keeping things up and running. And I personally, I don't know how they did it. And, we were struggling. I mean, you remember you didn't sleep for like 3 or 4 days in a row one time, but nothing to the sheer volume because the patients were coming at them.
Mm-hmm.
We were just trying to keep businesses up and running that were the affiliate businesses.
Right.
So the fact that they now believe that there was so much information sharing across all the organizations, whereas before there was a lot of, I don't know, I call it hiking my leg, my territory kind of thing, hiking the leg. But now people are sharing more. And I think they all firmly believe that if we can keep that going, and they think it will continue now, that it will only help us in the long run be able to react quicker when things are happening across the industry as a whole.
Mm-hmm.
But a number that I also, I didn't think about it before, but when they said that they saw numbers as high as 10 times the number of attacks. So remember I said that there were, tripled and quadrupled and all of this. And one of them said, I've seen the stats go as high as 10 times. But going back to the edge is now the home router. Not only is it 10 times more attacks, but it's 10 times more attacks against 100 times more vectors.
Yeah.
100 new routes in. So you're getting whatever preparedness you would normally have to handle the 10 times. you're short on staff because they're kind of busy, and you've got all these new routes in. So,
and all these new vectors aren't designed to protect against these things.
Well, nobody had time to do that.
Well, ain't
nobody got time for that.
But logistically, it can't really happen.
Well,
not in that time frame.
Well, yeah, and we now are in a world. We all agree it's never going back to the way it was before.
Mm-mm.
And we're now in a world where any device anywhere in the world may need to be provided real-time access and real-time security is what is expected, but that's just it's not feasible in the world that cybersecurity lives in, because the attackers constantly, we'll build this wall here, and they're like, I see your wall, and throw something over.
Yeah.
And the extortionists, they're just coming at them.
Mm-hmm. It's like seeing the cartoons where the guy's like knocking on the door, trying to kick the door in, and all you have is really the front of the house. If they just walked around the corner, it's just a fake wall.
Yeah.
It's kind of like what it is. It's like you build this thing you think is a defense, but it's really just a fake wall.
Yeah.
They just walk right around it.
Yeah, and they're just walking around. They're not even knocking on the door. But this whole group, either part of organizations that work with large healthcare systems, they're all large entities.
Mm-hmm.
And one thing that they all really agreed on after they had talked about this massive amount of stress, constantly worried that something's going to happen and shut down the system. Right? If you shut down the IT, we already know that is not good. It's a patient safety issue.
Mm-hmm.
They all, to the person, agreed. We have no idea how smaller organizations are handling this.
They're not.
Well, they are if they're working with folks the right way, right?
Yeah. As a whole, they have a lot of work to do.
Mm-hmm.
We still struggle with just telling people when you have a decision that needs to be made that regarding technology, bring us in the conversation.
Yeah,
we still have a challenge with that. Like, why are you bringing us in at the last minute? Or you're calling us and going, there's a copier vendor on site. And, okay, wasn't this scheduled? Yeah, we scheduled it a month ago. Well, okay. We should have talked about this way before now. It's amazing. And, you got decisions about we're going to expand the company, or we're going to buy another location. All this stuff involves IT, and yet getting to the table to say we should be part of that conversation so that we can make sure that we identify risk and then solve for those risks. And it's just
and to me,
challenge.
It's like, okay, I have a meeting coming up with folks who were like, our objective is to acquire 15 practices this year. And I'm like, so what's your privacy and security plan for those mergers and acquisitions and the evaluation of the liability you may be taking on? I think we need to have a meeting with you, But it's just like, that's the change we seek in the world, is that it's on the radar.
Yeah.
It should be. I just finished one of the courses that we're developing now, talking about the importance of privacy and security by design. It is built into everything that you're going to ask about it, and that's where we have to get to.
Mm-hmm.
In the meantime,
I
don't know how we're going to go, but
things are looking sad.
Well, thank you. Not the people that are listening to this, they get it. So we're moving forward there. Which also, speaking of that, brings us to another topic that was business associates.
Maybe we had our listeners like podcast shaming people. You don't listen to me with HIPAA? Shame on you. You definitely don't take private security seriously. You're not listening.
I know, right? So business associates, hello. I don't know how many more times we can talk about supply chain and how this is changing, but the only question is, are they aware they are the supply chain?
Yeah.
I just sent you a new one I was reading this morning that's a cloud provider and managed IT services that now you've got all these groups are having to report a data breach all of a sudden. And then another one that apparently had PHI on GitHub. It was a business associate. So I'm getting the details on those. We'll talk about those at another time, but those are just a couple of examples. And it's why every software company, every business associate that we're working with, we really want them to get the importance of doing what you're supposed to be doing and being prepared for questions. I mean, one of the things we haven't even had time to cover is there was an update to HIPAA in September, October, November, the end of 2020. There was an update to HIPAA, which is the supply chain assessment guide, and specifically says this is designed for small organizations. Now, it's designed for small organizations by people in big organizations, but we're working with that too. I mean, I'm looking at how do we incorporate more of those things. The bottom line is, it's time to wake up, folks. All your upstreams, they're starting to pay attention and ask more questions, and they're worried that you're not doing the same in your downstream. So if you're getting asked questions, you should be asking questions to the people downstream.
Yeah, because when something goes wrong here, it don't go down, it flows up.
Yeah. So you're going to take the brunt of it, and just know that if you haven't started, how many times have we talked about this over these 300 episodes, that the pushback that I had gotten for years about asking about your compliance program, and literally people yelling at me that I shouldn't even ask the questions. I mean, I've been on a conference call with a whole room full of people with a C in their title, literally yelling. And I mean, like, literally that, this was ridiculous to ask these questions. I'm like, they're questions. You answer them, you don't answer them, well, it made them look bad and they didn't like it. So they just didn't want you to ask the question. I'm like,
yeah. Do not open that door, Donna.
I know, right? It's kind of like the kid that said, I didn't clean my room, but don't open the door.
Yeah.
I cleaned it.
Don't look under the bed. Don't look under the bed.
Don't look under the bed.
Or as we say around here, don't look in the closet. The house is clean. Don't look in the closet.
Yeah. My favorite is the last minute throw stuff in the washer and dryer.
Oh, yeah. Find all
That's
kind
a
of
great
stuff
trick. But anyway, there was a great discussion about business associate agreements and how all this remote work has turned things upside down. And if you think about how your business associate agreements that have not been reviewed require certain things, and I was enjoying there was the terms I was telling you about that I thought were really cool and we're going to start using because it's so much easier than onboarding and termination. They call it arrivals and departures.
I know. I like that.
I'm a fan. So I did pick that up and made a note. Cool terms to use.
Yeah.
And circled it. But the big thing is if you haven't reviewed your business associate agreements, there's possibility that there's things in there that could be impacted by now everybody working from home at your business associate, that they've agreed to secure things a certain way and now they can't because everybody's working from home, those kind of things. There's a lot going on in the business associate agreement and the issues. The fun thing was every person, it was a group of lawyers, every person, there's like all these lawyers and a doctor, but other than the doctor, all the lawyers agreed that your BAAs need to be managed at the beginning of the sales process.
That That sounds so remarkably familiar.
I know, right?
I know.
It sounds like something we teach in the boot camp.
Yeah. I mean, yeah. We should iron this out before we talk about anything else because we can't get past this. No need to talk about anything else.
One of the things they were talking about that really needed to be vetted now is your IT vendors and folks like that need to be vetted, and the vetting process needs to be in the contracts. So start looking for these contracts to change. This is also the area that if you don't have it in the workflow, it always makes me think about when our puppies, the Shelties we had for years, they would start to learn to really run when their legs got longer all of a sudden.
Mm-hmm.
And they're sheepdogs, so they're designed to run fast and make quick cuts. They're low to the ground, but they're not used to their legs being long. Mm-hmm. So they'd be tearing around the corner, making a quick cut, and all of a sudden one leg would just shoot out. Wait, I don't know how to control. Get back over here,
Yep.
It's exactly what happens if you don't have the BAAs into the contract process.
Mm-hmm.
Is they may all be in there, but randomly, one's just going to get left out, or one's going to get put in. It's never the same. You're always going to have one doing one or the other. Another thing that they brought up is they found a contract, a BAA, in a review during a merger. They found a BAA that allowed for a 6-month delay in breach notification. How's that? How? And another great phrase that you use is when you're talking about training and they're like, why do we have to do so much training? Okay. I will not be an Olympic athlete if I don't do regular training.
Mm-hmm.
I will not be even on the varsity team if I don't do regular training. So those who expect their staff to protect them at a level of varsity, but they're training them at a level of PE class. Today we're doing basketball. And so the sports analogy for those, and a lot of people get the varsity and all that kind of stuff. So the sports analogy works.
Mm-hmm.
So I thought it was a really great way to bring across the importance of training in a manner where leadership could really grasp why it's something that has to be built in regularly. Because, this is literally something you need people to do every day, and it's not something they're thinking about every day. They're not going to do it every day.
Right.
So those were some good things on the BAA and the BA discussion. I will bring up that, as people know, we go out of our way to make sure we tell everybody we are not attorneys. We will not give you legal advice. We do not act like we could, all I can do is offer to testify in court with what I know. I'm not going to give you any other advice. And we even have it. It's everywhere.
Mm-hmm.
Yet attorneys feel like they can offer cybersecurity advice. And some of them do know it.
Mm-hmm.
But the vast majority do not.
Right.
And they think that they can write the policies and procedures for security. How? How are you going to write it for recognized security practices? You're going to read the 405D technical guide and turn that into a policy and procedure? I'm building things based off of it, and I understand it. What is going to happen? So if I spend all my time making sure I tell people I'm not lawyers, I would like to request that the lawyers who do not truly understand cybersecurity and IT start trying to realize that, because it's different now.
Yeah. They're certainly not keeping up with it for the most part. I wouldn't imagine they have time to do that. It's not their forte.
No.
Yeah.
You know?
I mean, we have enough problems where practices are saying, we have a healthcare attorney. And so we ask them about compliance stuff. And I'm like, dude, a lot of these healthcare attorneys don't do anything with HIPAA at all. They do med mal, and they look at contracts and stuff like that. They don't do compliance. So you're asking them questions in stuff that they don't deal with.
The funny thing, if you haven't heard it, like David hasn't heard it yet, I was interviewed on the Caveat Cyberwire podcast, which is about policy. And Dave Bittner is the host, along with Ben Yellen, who is an attorney. And by the way, they go out of their way to say he's not offering legal advice, even though they talk about legal things. But after the interview, there's a clip where they're mentioning it, and Dave says something to the effect of, you're an attorney, so I'm sure you read this stuff, but those of us who don't, we appreciate having somebody like Donna around. And Ben goes, lawyers don't like to read HIPAA. So no, they don't, but I plenty of times brainstorm with lawyers over how things are, what the regulations say, and should this be included or not. I totally get how complicated it is from a legal standpoint. And there are plenty of times that I prefer to ask an attorney about those things, but I'm not seeing them make that changeover when it comes to saying, these are your cybersecurity things. They'll just say, talk to IT.
Mm-hmm.
Or, and that's not what you should do, by the by, or they will say, well, that's okay. And they'll worry about the patient legal side of it.
Mm-hmm.
And that was a discussion that they're worried about. What is it legal for the patients to use this app? And yes, no problem there. However, have you thought about the security implications and social engineering implications for the provider?
Mm-hmm.
No, they didn't even get that. So anyway, there's my rant.
Yeah.
For the day.
And sometimes I've seen stuff where they'll, not necessarily the attorneys, but sometimes people will say, well, if the patients do X, Y, and Z, it's on them. Okay, I get that, but do they know that? Like, have you explained the implications there?
Because they're going to blame you when it.
Yeah. Like I sent them an encrypted email, but if they reply to it, it's replied to in an unencrypted fashion at that point.
Mm-hmm.
Okay. Do they know that? Because they might not want that to happen. I understand that they can do it and get away with it, but that's probably not what they want.
Yeah. So you're supposed to understand how to secure my information, not me. That's the whole thing. But there are plenty of things that we need the attorneys to do, and cybersecurity is not one of them.
Mm-mm.
Now, if you happen to be someone that is, and there are plenty who actually do have a lot of technical skills and do understand cybersecurity,
mm-hmm.
but not all.
Right.
So I'm just going to leave it at that. Anyway, the concept of remote workers and all of these things, we know it's here to stay. We know we have to change the way that we're dealing with things. Many of the groups that spoke talked about the fact that, in some cases they had already converted office space when they realized they didn't need those employees to come back. They're converting office space now to patient care areas, and patient services and those kind of things, because now we're just going to have them work from home. So the home office is now officially, as we say, the edge of the world as we know it.
And that's scary.
Yeah. So let's hit the thing that really folks need to figure out.
Okay.
Because to me, this is something that if you don't truly understand it, there are so many ways this could go rapidly downhill. And we briefly mentioned it before. It's one of the things we talked to Eric about, Eric Decker, when he was on the podcast. And it's the changes to the Stark Law, not the Tony Stark Law, the Stark Law and the anti-kickback statute that allows the donation of cyber security tools and services. It is very, very specific, and then again, very broad.
It's broadly specific.
It's broadly specific. But, you know, it is, it's one of those things where now, where before it was considered, you know, giving somebody a kickback and fraud and whatever, if you gave them something and they were sending patients to your health system or your hospital. Now they're saying, because the community as a whole is impacted by cybersecurity, and if you're going to have other people connecting into your systems, which we need them to in order for us to all share, then we need to be able to secure them, and they may not have the funding to do it. Great idea. Until you go to figure out what that means. I can see it now. You're going to go into a practice at some point, and they're going to go, nope, hospital gave me everything I need for security. I don't need anything else. I got HIPAA covered. The hospital gave me everything. No, it's impossible. Let me just give you that. Only thing they're allowed to do is provide something that's specifically involved in cybersecurity.
Right.
Okay. And then there are questions about exactly what that means when it comes to services. Oh, okay. They're going to give me a firewall. Does that mean they're going to pay for the ongoing maintenance and upgrades of the software? Who's going to configure the firewall? Who's going to manage the configuration of the firewall? Who's going to pay for that? Because you got to work that out. It's not just, hey, here's a car.
Free car.
Yeah. And because it has to be specific to cybersecurity, I can offer help desk to handle cybersecurity issues, but not a password reset. That's normal tech help desk. You know, so it's you've got to know what that involves between the two. And with that in mind, the hospital, health system, whatever, they can donate the answers to cybersecurity questions, but they cannot donate the services that are help desk that will allow you to, I can't print, you know, my favorite one. My email doesn't work, and password resets. I mean, those are like some of the top three, right?
That's every Monday morning. Especially here lately, because Microsoft breaks everything every weekend. Always terrible.
Well, and you know what fascinates me is the number of people that their password worked fine on Friday, and now it doesn't work on Monday, and nothing changed. And we have the evidence right here on the screen. Nothing changed but you.
Yeah. Well, my thing is there should be a policy. Everybody listening, you should have a policy that says, do not do a password reset on a Friday, because you will not remember that password on Monday.
Unless you work Saturday and Sunday.
Yeah.
But that being said, those aren't covered. So all of you MSPs out there, you're going to need to know where that line is. Because now they're going to suddenly say they get help desk, and you've got to be able to reply, okay, do they cover these things and handle that? But also, there's services they can provide. They can provide training, but it has to be only on cybersecurity. This will not handle your HIPAA. Please, it will not handle your HIPAA. So one of the things that I could see, you know, kind of a question, and so I submitted this question into the group that was discussing it, because I wanted to see how the line was drawn. And, you know, to know whether the internal or outsourced and, you know, co-managed, whatever you want to call it.
Right.
So I could see, we all know that one of the top ways that malware gets distributed is through an infected Microsoft Office file, whether it be document, spreadsheet, those are primarily your issues. And often because they have little macros they allow to run. Those things are often not patched. And, you know, I would not be shocked if here we are in 2021 and I found somebody running Microsoft Office 2010, 2013.
I wouldn't either.
You know,
I know people still running DOS versions of EHR. Blows my mind.
I know. I don't get it. But, and my question was, okay, we know those are specific cybersecurity threats. We know that. Does that mean now I can donate an upgraded version of Microsoft Office to block that cybersecurity threat or to mitigate the cybersecurity threat?
Did you get an answer?
Yes, I did.
Okay.
I did get an answer. It has to do with the functionality of the software. I do not buy that software for cybersecurity.
Right.
I buy that software for collaboration and creation. Then it does not apply.
Can't be donated then.
Right.
So if its primary use is not cybersecurity, then it does not fit.
That's its primary functionality has to be related to cybersecurity.
Interesting. Good question too, by the way.
Oh, thank you for approving. It means everything to me.
I'm sure it does. I'll give you a seal to put on your website. Approved by David.
Oh, please. How did I get into this mess with him? But the bigger issue here is that confusion that's going to happen. Okay. Imagine, David, because you have a full security suite.
Yes.
Now, the health system is going to donate an antivirus, let's say it's semantic security. Okay. That would apply.
Right.
That would apply. What you're going to do now as an MSP, that comes for free, and it will screw up your stuff.
Yes, it will.
So if you don't start figuring that out, it's going to blindside you. And note that it can come to, okay, you usually go in, and this is all MSPs are doing this now because it's just so much more effective and efficient to essentially just include routers and firewalls.
Right.
So I can manage them and you standardize them. Well, now those are going to be donated, and you may or may not have control over it.
Yeah,
what you going to do?
It's going to be complex. I mean, we do have clients that have hardware outside of what our typical standard is. And it's usually because it's a large organization, and snatching firewalls out is not something you want to do in a large organization.
Exactly. Yeah.
You just kind of wait on it to die, and then you cross your fingers and, hope you reconfigure everything properly. Not really, but that's the way it feels.
Yeah.
But that piece wouldn't be as bad, but not being able to have any access to things is going to be a level of complication, because oftentimes we have to move at the speed of light. And if we have to jump through tons of hoops and nobody knows who to contact, and, you got an active cybersecurity issue going on, an active breach happening, and you're calling around going, who has credentials to this stuff? Oh, no. We done that to them 2 years ago. We gave it to them. Oh gosh,
right.
Now
so you better be in on that cybersecurity help desk.
Yeah, I mean, it would be great. I don't know how they could do this, or if they can. It would be better if the hospital system could say, we want to give these services, but we want to do it through a specific MSP or set of MSPs.
There doesn't appear to be a problem with doing that.
That would be great.
Right.
Whether they picked one or whether they picked several to rotate through, but at least they are saying, we want to buy something that you already have in your stack, your security stack, and we want to donate that. So you can manage it, monitor it, and all that. So you remove all the other problems and complexities of just throwing whatever out there, and hoping somebody can manage it. Because I'm telling you, that's going to be a mess.
I told you, rapidly downhill.
Oh,
I could see so many things. Now, another question I asked that just got nobody's touching it, apparently, was, is it going to be clear in any of this stuff that it does not mean these donations would satisfy your HIPAA security obligations? Because I can see that. I can see it everywhere.
I would think you're going to have most MSPs, they're going to take one of two approaches, or maybe three, but they're probably going to say either, glad you got it donated, we're not going to support it, which I could see happening. So, or it could be glad you got it donated. We will do our best to support it. And here's increasing your bill to reflect the complexity and aggravation that you have now given to me. And it will. Yeah. You know, I would do it, but yes, I'm going to charge you more money to do it because it's going to take me more time and effort to do it. And not to mention the liability.
You've got to figure out as an MSP how you're going to deal with this. And I don't know the right answer, but I do know it. First of all, you know, it was like Eric pointed out, not all health systems and hospitals have the money to do this.
Right.
That's going to be first. Don't think everybody's going to do it. But if they have the money and they're allowing people to connect in, you need to be aware this is probably coming around. So keep that in mind in a big way. And it will be confusion.
Oh, yeah. It's going to be a mess.
Yeah.
It's going to be a mess.
So in theory, it's a great idea.
But here's the other thing. Let's say they do get MSPs involved. Is the hospital really going to want to recommend a specific MSP or set of MSPs? Because now you're basically saying we're endorsing those companies. Yeah. I mean, it's a mess.
Yeah. Great idea. But somebody's gonna get hurt as we figure out how to play this game. There's gonna be some injuries.
It's all well and good until somebody gets hurt.
Well, I definitely, I'm going to be paying attention and watching for it to see where it starts happening. I mean, Eric was well aware of several CISOs at organizations that had been waiting to be able to do this. And I understand their side of it. I totally understand that they need to do something. And maybe what we look at is the ones where they want to donate are the ones where they're seeing the most crap, meaning they don't have an MSP.
Yeah, that's likely too. So I don't know.
But then as an MSP, when you finally do go in there, what do you do? So, I mean, you've got to understand both sides, 3 sides actually, because there's 3 different folks involved.
Yeah. I mean, there are some stark issues here.
Okay, so that has, as I predicted, gone rapidly downhill. So off we go now. I think we're done for today.
Oh man, I just brought that train to a complete stop.
I like the fact that you kept a straight face. I was just like, for as long as you did, I was just waiting. Paused. Oh, dude.
Yeah, I got to make up for yesterday. Yesterday was April Fool's Day, and I did nothing.
I know it's the first time in a long time that I haven't done something.
I know. I feel so bad for not, just absolutely creating havoc yesterday.
I've had some really good pranks before, but
yeah. I've had some that probably would have or should have included either me going to the hospital or early divorce, but neither one happened, so I'm good.
Oh, I got good stories, funny things, but it's not for today, my friend. Not for today.
That is right. All right, let's wrap it up. Remember to follow us and share us out on your favorite social media site. Rate us. Give us a thumbs up. 5 stars. Good rating. No 4s, no 3s, no 2s, no 1s. Help us spread the word. And, don't feel bad if you have to podcast shame people. Look, it's a thing.
Yeah.
Look, you got to be listening. Otherwise, you ain't taking it seriously. So remember, for Donna and myself, HIPAA's not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.